Most people do not misunderstand Medicare because they are careless. They misunderstand it because they are tired. After decades of dealing with insurance cards, deductibles, provider networks, paperwork, premiums, bills, and fine print, Medicare can begin to feel like a finish line. A moment when healthcare finally becomes simpler. A moment when one of life's heaviest worries might finally loosen its grip. For many Americans, reaching Medicare age feels like stepping into a safer room, but then the room still has bills in it. The premium is still there. The deductible is still there. Prescriptions may still cost money. Dental work can become a separate problem. Vision needs may still appear. Hearing needs may still matter. A hospital stay may still bring costs. And slowly, a quiet truth begins to show itself. Medicare helps. But it does not make healthcare disappear from the budget. That is the Medicare cost trap. Not that Medicare has no value, it has value. Not that people should be afraid of it, they should not. The trap is the assumption that once Medicare begins, the financial pressure of healthcare is finally over. Coverage is not the same as breathing room. In 2026, the standard Medicare Part B monthly premium is $200.90. The Part B deductible is $283. The Medicare Part A inpatient hospital deductible is $1,736. These numbers may look ordinary on paper, but inside a retirement budget, they have weight. They sit beside groceries, rent or mortgage payments, utilities, transportation, insurance, credit card balances, and all the other ordinary costs of staying alive, and that is where the fear begins. A person may finally have Medicare and still feel exposed. They may have coverage, but not certainty. They may feel grateful for the support, but still uneasy when a bill arrives in the mail. They may hold the Medicare card in one hand and a medical statement in the other, wondering why relief still feels incomplete. That is not failure. That is the complicated reality of retirement health care. According to Medicare.gov, original Medicare has no yearly out-of-pocket limit unless a person has supplemental coverage or joins Medicare Advantage. Medicare.gov also explains that original Medicare does not cover some common services, including long-term care, most dental care, and certain vision and hearing services. Those details matter because they challenge a belief many people carry quietly. Once I have Medicare, healthcare is handled. Some parts may be handled better. Some costs may be reduced. Some fears may become easier to manage. But the larger picture is still more complicated than one word, covered. There may still be monthly premiums. There may still be deductibles. There may still be co-insurance. There may still be prescription costs. There may still be dental bills, eyeglasses, hearing needs, or long-term care concerns. And there may still be the emotional strain of not knowing when the next medical expense will arrive. That is the visible problem. Medicare has costs, and retirement already has costs. KFF reported that Medicare beneficiaries spent an average of $6,330 out of pocket on health care costs in 2022. In 2023, KFF reported that Medicare beneficiaries spent an average of $6,459 out of pocket on health care costs. These are averages, not the story of every person. Some people may spend less, some may spend much more. But the pattern is clear enough. Being on Medicare does not mean medical costs drop to zero. And these costs do not arrive in isolation. In 2024, average U.S. household spending was $78,535. Housing and transportation accounted for more than 50% of household spending. So, when a retiree faces a health cost, that bill is not competing with nothing. It is competing with the home, the car, groceries, utilities, insurance, debt, and every other part of ordinary life. This is why medical expenses feel different. They do not behave like optional spending. A person can cancel a trip, delay a purchase, or skip a restaurant meal. But a prescription, a dental problem, a doctor visit, a hearing issue, a hospital stay, or a long-term care need carries a different kind of pressure. Health costs are tied to the body. They arrive with urgency. They reach into pride, independence, family, and fear. And that is what makes the Medicare cost trap so personal. The hidden cause is not Medicare itself. The hidden cause is confusing health coverage with full financial protection. People may estimate their retirement income. They may think about Social Security, savings, housing, groceries, and utilities. But health care is harder to hold in the mind because health itself is uncertain. A person may feel strong at 62 and still have no way of knowing what 72 or 82 will require. A budget may look calm on paper, but one medical need can change the emotional temperature of the whole month. Medicare Part D covered drug out-of-pocket costs are capped at $2,100 in 2026. That can be meaningful protection for covered drugs. But it is not a full shield against every health-related cost. It does not erase all premiums. It does not erase all deductibles. It does not cover every service. It does not make long-term care risk vanish. It does not turn retirement health care into something completely predictable. This is where many households begin to understand the difference between support and safety. Imagine Linda, a fictional 66-year-old. She is relieved to have Medicare. She is grateful for it. But her Part B premium, prescriptions, dental needs, rent, and groceries all crowd into the same month. She does not feel uninsured, but she also does not feel fully protected from medical cost pressure. Medicare helps, but the budget is still tight. Imagine Robert and Elaine, fictional retirees aged 68 and 65. They expected Medicare to make health costs more predictable. Then they begin to see how premiums, deductibles, prescriptions, dental visits, and possible hospital costs still compete with fixed income. They do not feel abandoned by Medicare. They simply realize Medicare was not the end of every medical bill. Imagine Michael, a fictional 58-year-old. He is not on Medicare yet, but he is counting on it for later life. He watches older relatives handle dental bills, prescription costs, premiums, and medical paperwork. He begins to wonder whether Medicare will help him one day, but not protect him as completely as he once assumed. These stories are fictional, but the fear behind them is very real. It is the fear of aging into a system that provides support, but still asks families to keep paying. The 2026 Retirement Confidence Survey from EBRI and Greenwald Research found that retirement confidence declined in 2026. Healthcare costs, Medicare, inflation, debt, housing, and Social Security were among the concerns weighing on workers and retirees. Only 64% of Americans said they were confident they had enough money to live comfortably throughout retirement. That loss of confidence makes sense when you think about what retirement must carry. Retirement has to carry income uncertainty, housing, transportation, groceries, sometimes debt, and the daily costs of living. Then healthcare enters the room, not as one simple bill, but as premiums, deductibles, prescriptions, uncovered services, and surprises that do not arrive on a convenient schedule. A medical bill is never just paper, it is a question. Can this fit into the month? Will this come out of savings? Will this go on a credit card? Will something else have to wait? Will this become a burden on a spouse or an adult child? Will this change what retirement feels like? That is the emotional cost of the Medicare trap. It is not only about dollars. It is about control, dignity, independence, the fear of becoming physically vulnerable and financially vulnerable at the same time. And this is why the conversation has to be careful. It would be wrong to say Medicare is useless. It would be wrong to say Medicare covers everything. It would be wrong to tell every person that one Medicare path is best for them. The truth is quieter and more mature. Medicare can be valuable support, but it still exists inside a household budget. For many middle-class Americans, the danger is not Medicare itself. The danger is assuming Medicare automatically removes all health care pressure from retirement. Because when that assumption is wrong, The surprise can be painful. A person may reach Medicare age and feel relief. Then the premium appears, then the deductible matters. Then the dental bill arrives, then a prescription cost shows up. Then an older spouse needs more care, then a hospital deductible becomes real. Then the household realizes that coverage helped, but it did not create as much breathing room as they expected. This does not call for panic, it calls for awareness. There is a quiet difference between being covered and being financially comfortable. There is a difference between having support and having enough room to absorb what support does not carry. There is a difference between believing health care is handled and understanding where the gaps may remain. For people approaching 65, this awareness can feel unsettling. For people already on Medicare, it may feel familiar. And for people in their 40s or 50s watching parents age, it may feel like a message from the future. The purpose is not to make anyone afraid of Medicare. The purpose is to see it clearly. It helps. It matters. It is a major part of retirement health care for many Americans. But it should not be mistaken for the end of all medical financial pressure. A Medicare card beside a medical bill tells the story better than any slogan. Both can be true at the same time. Coverage can exist, and costs can remain. Support can exist, and stress can remain. Relief can exist, and planning can still matter. Healthcare is different from many other retirement expenses because it is not just another line in the budget. It is tied to aging, pain, mobility, family, fear, and the private wish to remain independent as long as possible. It touches the body before it touches the wallet. And once it touches the wallet, it can change the whole feeling of retirement. When medical costs compete with housing, transportation, groceries, Social Security income, and household spending, retirement can feel smaller than expected. Not because people failed, not because they were careless, but because the cost of staying healthy is more complicated than the word Medicare makes it sound. So the warning is calm, but serious. Medicare can help carry part of the burden, but it may not carry all of it. Premiums still matter. Deductibles still matter. Out-of-pocket costs still matter. Uncovered services still matter. Dental, vision, hearing, and long-term care risks still matter. And the older a person gets, the more important it becomes to understand the difference between coverage and breathing room. Because the Medicare cost trap does not begin with the bill. It begins with the assumption that the bill will not come. For many Americans, the most honest truth is also the simplest one. Medicare is support, not a magic shield. It can make retirement health care more manageable, but it does not make health care disappear from the budget. Coverage is not the same as breathing room, and in retirement, breathing room may be one of the most valuable things a household can have.